Good afternoon, everyone. I am Johanu Botha, the Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. As of today, more than 1.75 million doses of vaccine have been given. More than 79% of people aged 12 and up have had at least one dose of the vaccine, which means we are less than 1% away from our reopening plan's third milestone for dose ones. And almost 68% of Manitobans who are eligible have had 2 doses, making Manitoba one of the most vaccinated provinces in the country. I want to thank everyone who has made this milestone possible. The immunizers and navigators of super sites, the focused immunization teams, the physician clinics and pharmacies, urban Indigenous clinics, the regional health authorities, and all of our community partners. Your work is allowing us to once again begin gathering with family and friends. It's kept people out of hospitals and helped reduce the burden on our healthcare system and on healthcare providers, and it saved lives. Our super sites are still an important part of the rollout for now, but as the vaccine campaign evolves, the demand on our super sites and clinics are changing. We are continuing our shift from the focus on volume towards access and accessibility. Part of that shift will involve adjusting the days and the hours of operation in super sites across our province. The change in days and hours of operation at the sites will begin next month. So while this won't impact accessibility so much, because super sites have never been the ideal model for accessibility, and we have our various accessibility channels out there, this will result in changes for our staff, including an adjustment in available hours or locations of work. We have asked staff to provide feedback on the positions and the options that will work for them, and we will be working with them throughout this transition. However, especially for the month of August, if there's a need, we can quickly adjust and revamp our hours at the super sites. So in that sense, as we focus more on outreach, this is more of a ramping out than a ramping down at this stage. That's the benefit of our model. That's the benefit of the Manitoba model that we've put together. With our various delivery channels, we have the flexibility and capacity to pivot if we see an increasing demand in one of those channels. So if for some reason demand spikes in such a way that using our super sites makes most sense again, that will not be a barrier to us reaching our targets. Now, as we look towards the fall and begin to implement changes at the super sites over the month of August and beyond, we know we need to continue our other approaches to get us to where we need to be, to ensure the vaccine remains available and accessible to everyone who is eligible and to those who might become eligible. So we're going to ensure we maintain all the necessary tools in the toolkit to keep immunizing as we need to. For example, the 5 urban Indigenous clinics continue to offer vaccines in trusted spaces. These sites welcome their communities and offer culturally appropriate supports. We'll continue to offer vaccines in convenient places where people are already, such as we're doing throughout the summer weeks in provincial parks. We continue to work with community partners, of course, to help them reach their members through education or a community-hosted clinic. In total, we have distributed more than 40,000 doses to these unique community-hosted clinics, and these are integral dose ones to reach people who may have had a barrier to reaching a super site or one of our pop-ups. Last week alone, about 8,000 first doses were available at these clinics in 16 different communities, and we are set to have a similar week this week, and we hope to continue this going forward. Community organizations like the North End Women's Centre and the Punjab Cultural Centre have hosted clinics. We continue to work with physicians and pharmacists to offer vaccines to communities that may face barriers to the vaccine, including in workplaces. This includes other examples, such as Access Downtown and the Norwest Community Co-op. Last week, our mobile clinic was in Langruth. A pharmacy offered a pop-up clinic in Altona, and the health center in McGregor also provided doses on site. Applications will continue to be accepted for the Protect MB Community Outreach and Incentive Grants. A complete list of all the organizations approved for funding to date Some of them have been communication, some have been outreach, some of them have been community-hosted clinics where vaccines are administered. That full list is at protectmb.ca. These grants support outreach and incentives to encourage people to get vaccinated. Moving forward, even as we begin to adjust these hours and days at our super sites, all of these kinds of approaches just mentioned will continue to get our vaccine rates up. Thousands of people have rolled up their sleeves to access the vaccine, and we want to make it as easy as possible. And of course, thousands have also applied for their Manitoba immunization card. Our work continues to address the corrections, and we are making good progress every day. We are escalating those that have taken longer to resolve. And as we keep administering thousands of vaccines each day, a small percentage of those do keep popping up as queries. While most of the work on addressing these queries is up to us to address and to fix, there are some small things that you can do to help us out. The most common error of all that we've seen is that the last name a person enters does not match the last name on someone's health card. This, for example, might happen when someone gets married, and if they did change their last name after they were married, it might not line up to the name on their card, and this could pop up as a records correction issue, and there could be a delay. The health card could also show a hyphenated last name. This is quite common, but the person enters a space on their application. Out of the thousands of requests for error corrections, more than 8,000 have been due simply to last names used not matching health cards. So when you're applying for your immunization card, please enter your last name exactly as it appears on your health card. For those of you who are still waiting for your physical immunization card, remember that the digital card is available for use immediately. We expect thousands of people to be using their digital or physical cards next week at the Bomber game. While people will be on hand to help you, of course, we strongly encourage people to be familiar with how to access their digital card before you get to the game. Make sure that you can access your card easily or bring a readable, high-resolution photo of the QR code. And don't forget to bring a government-issued photo ID, such as a driver's license or a passport. This will allow the staff to check the name on your card with your ID to make sure you're showing a valid immunization card. We want to make it as easy as possible for people to get immunized. The vaccine is here. There is more than enough supply. We have a dose for everyone who wants one. If we count the people who already have appointments in our system, then we only need approximately 4,000 more first doses and approximately 40,000 more second doses to hit the third targets in the reopening plan. Hitting those targets could be, and very likely is, right around the corner. Make that call for an appointment today. Find a walk-in clinic. Protect yourselves, protect others, protect Manitoba. And with that, I'll pass it over to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Joss Reimer, Medical Lead of the Vaccine Implementation Task Force. Today, I wanted to begin by speaking about antibody testing. Because antibody testing is one of the measures of success for vaccine research, many people believe that getting one of these tests can show that they are immune to COVID-19. This, however, is not true. When these studies and tests are used to examine the effectiveness of a vaccine, antibodies are not the only thing that are measured. Vaccine immune responses are much more nuanced than just checking for antibodies. And in fact, sometimes antibodies are not the best indicator of immunity and are one factor that is included in the research. These tests are expensive and they are not necessary for individuals. And they may lead you to a false sense of reassurance that you cannot get sick. Getting an antibody test is also not a reason to justify not getting a vaccine. There are many research reasons to get this testing, but there's no reason for anyone to make that decision for themselves. The information an antibody test gives you as an individual is not enough to be meaningful, and we don't yet know how to interpret the numbers that you are being given. The best thing that you can do to be reassured that you have some protection against COVID-19 is to get the vaccine, even if you have already been infected. I would also like to quickly touch on myocarditis. Manitoba has seen a small number of cases of myocarditis following a dose of immunization. These cases have almost exclusively been amongst young men. However, as was seen in the United States, these cases have been mild and treatable. The fact that we were able to detect and diagnose these cases, despite how rare they are, shows how good our vaccine safety and monitoring system is. For those who are hearing this news and wondering if they should get their second dose, it's important to remember that COVID, the virus, also causes myocarditis. Myocarditis can be caused by many different viral infections. And cases of myocarditis that develop after getting COVID tend to be more serious than those related to the vaccine. We know that other viral infections cause myocarditis, and they do so at much higher rates than what we're seeing with the vaccine. Again, most myocarditis cases reported after vaccination are very mild. Some people have been admitted to hospital for observation, but are then sent home to rest and take medications. Others are sent home right from their initial assessment and are also told to rest and take anti-inflammatory medications. I also want to take this chance to touch on a common question that we have been hearing throughout this vaccine rollout. People have asked and still ask if it's true that vaccines cannot affect your DNA. This is entirely true. The best way to think of messenger RNA is as instructions for your body. Our body produces messenger RNA all the time. This is how our body provides instructions to cells on how to produce many different things in the way we function normally. In this case, rather than our body making the messenger RNA, the vaccine provides it. But the instructions are still read and managed the same way as always. Once the instructions are inside the muscle cells of the injection site, the cells use those instructions to make the spike proteins. After the protein piece is made, the cell then breaks down the instructions and gets rid of them. The instructions are not stored anywhere in your body, and they never enter the part of the cell where DNA is stored. So after producing the spike proteins, the cell will display those proteins on the outside of the cell. Our immune system recognizes that that protein isn't normally there, and so it begins to build an immune response to it. And at the end of the process, our body has learned how to protect against future infection, because when it sees those proteins on a virus in the future, it will already recognize them. The role of mRNA in this process, as I said, is instructions. mRNA is not the same as DNA. mRNA never enters the nucleus of the cell, which is where the DNA is kept, and our cells break down and get rid of mRNA soon after they're finished using the instructions. So this means there's no way that the vaccine will alter our DNA. So if you haven't yet, I encourage you to book your appointment and get your vaccine. Another reason to get your vaccine is related to some of the long-lasting symptoms of COVID. For example, there's a new study from Switzerland that found that more than 25% of people who were infected with COVID were still experiencing symptoms 6 months later. So we know that this virus can have lingering effects. The long-term symptoms can include things like fatigue, shortness of breath, and what some people are calling COVID fog. I was actually just talking to a university student this week who was telling me that she is still experiencing difficulty concentrating months after having her COVID infection. This is all the more reason to go get vaccinated, even if you are young and healthy. Getting 2 doses of a COVID vaccine will give you the best protection possible. I want to remind people that you don't have to have ID or a health card to get the COVID-19 vaccine. Certainly it is helpful to have ID as it facilitates the process, but if you don't have ID, please still come. You can call our appointment line, and there are many language services available when you are booking. They can help walk you through the process of being immunized. And again, I encourage everyone who hasn't yet done so to make your vaccine appointment. The more people who roll up their sleeves, the sooner we can reach a post-pandemic Manitoba. With that, we will turn it over to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Skylar.
Hi there. Thanks for your time this afternoon. Dr. Reimer, I've got a couple questions about some young Manitobans receiving the vaccine. Over in Alberta and BC, someone with a 2009 birthday, regardless of if it's passed or not and they've actually turned 12, can go get a shot. They can book in. They can, go get it tomorrow if one was available. Given that we're trying to immunize as many people as possible, and of course the school year is coming up and there's going to be quite a few unvaccinated children congregating together, wouldn't it make sense for Manitoba to adopt this approach? I'm just wondering what the difference might be between our province and some others that are doing this.
So Health Canada approved the use of the vaccine for people who are 12 and above because that's who was included in the studies. So the studies didn't use birth year, they used the age of the youth in the study to indicate safety and effectiveness. That said, sometimes there are logistics reasons why one jurisdiction would use a birth year as opposed to age to book appointments and offer the vaccine. So far in Manitoba, the way our operations are set up, there's no logistics reason that we need to use birth year, and so we've been able to stick with Health Canada approvals. We would love to extend vaccination to more people. I would love to go beyond the birth year of 2009, but we don't yet have the research on people who are under 12. Now, all of that said, as we're moving into the new school year, we're considering whether or not we can offer vaccines in schools. And one of the things that we'll have to revisit is the logistics around things like birth year versus age if you're talking about a class cohort. So, all options are still on the table for that. And when we make a decision about school-based campaigns, like I said, we will revisit and assess whether or not it's feasible for us to stick with 12 plus, or if we will need to move to a birth year eligibility.
Okay, thank you for that. Obviously, parents are looking ahead to the school year, and there is a lack of transparency about what's going to be mandated in terms of safety and all that kind of stuff. So some of the parents have told us they're actually looking at taking their province or their kid 2 provinces over to Alberta to get a shot. What would you say to those parents who are willing to make that effort and go on an hours-long trip when it theoretically could be done here in Manitoba?
Like I said, we're trying to offer the vaccine to everyone who is eligible, everyone who has had research available to show that it's safe and effective. And for logistics reasons, we may have to change that in the future. And parents will have to make difficult decisions about what to do for their individual child and look at the risks and benefits of traveling for a vaccine versus waiting for more information from Manitoba. But we are working on this actively. We are working with education to have discussions around what will be feasible in the coming school year. And as soon as we know what the plans are, we will share that information.
From the Winnipeg Sun, Josh.
Good morning, or I guess good afternoon. We are, or there's other jurisdictions that are looking at using a third shot of vaccine to account for some of the issues when it comes to travel, where certain jurisdictions are not allowing the mixed doses of vaccine. Is this under consideration in Manitoba? Is this potentially going to happen here as we stockpile some of the doses that we have that aren't being used? What are we looking at that way?
I can take that one. So, I mean, clinically at this point, there's no clear benefit to receiving a third dose. We have looked at studies on how immune systems maintain protection against the virus over time. And for example, Pfizer had a study that showed that they remained 91% effective at the 6-month mark. And so in the absence of clear benefit, we can't recommend a third dose to individuals where we know that there is a very small but not zero risk associated with each dose of the vaccine. And we continue to prioritize the safety and the health and the protection against the virus for all Manitobans, and we'll continue to do that going forward. We don't have any ability to know what all of the different countries and all of the different companies may choose to do as far as eligibility and recognition of different products, of different schedules. But I do anticipate that while they're starting with very strict and cautious eligibility, that most countries and most businesses will be expanding to accept mixed schedules because a mixed schedule is being offered in many countries. We know that Germany and Norway, Sweden, Spain, France have all in one way or another offered mixed schedules. So we anticipate, though can't guarantee, that the eligibility will expand over time. It makes sense to be cautious and very narrow in eligibility when we're just opening things up for the first time. But as we all learn together globally, we expect that that will change over time. So we have no plans right now because there's no clear medical benefit for the third dose to offer it. But absolutely, if we see that there is no change to any of this eligibility, we can revisit this.
And you get to talk about the high levels of uptake that we've had so far. But when we look at doses that are being projected for next week, they're falling way off. Are we starting to hit a plateau in terms of being able to, or in terms of Manitobans willing to get the vaccine? Are we kind of maxing out? I know there's always going to be some kind of top end. I know other jurisdictions have run into this. Is Manitoba starting to hit that point where we're running out of people willing to get the shot?
So there's thanks, Josh. So there's a couple things there. We started seeing a relative slowdown on dose ones, I would say, about 3 weeks ago or so, in alignment with the rest of the country, and then a little bit less so on dose twos because that sort of interval kicked in. So there's so many individuals who can book after they've got to their the 28-day interval, but we have seen an overall slowdown between 2 to 4 weeks ago. I don't think what we're seeing now when we look into the future is as a new sign of a greater plateau or slowdown, or certainly not a stall. What we're seeing is that the way we project doses is largely based on appointments, and individuals are using appointments less and less because of all the accessibility approaches out there. So the more and more there are walk-in options at all our super sites now. There are doses of both types, and in some cases of 3 types, of over hundreds in pharmacies and physicians. So, and to name but a few, our pop-ups continue. So I think individuals are more and more just showing up to get the dose and planning their lives around it, as opposed to using the appointment-based model. And our forecasts are based on the appointments. So we are sort of seeing this baseline, this floor level projection of low doses next week and going forward. But they just capture what's already in the appointment-based system. I think a better predictor now on what immunizations might look like over the next weeks is not so much the appointment-based projection, but rather the actual behavior of Manitobans over the last couple of weeks. And what we've seen for 14 days plus now is a 0.2 approximate rise in the dose ones, and between a 0.7 at the low end to a 1.2% rise on the dose twos. So if that holds, and I don't have any evidence to suggest why it wouldn't hold because it's been so steady for a couple of weeks, we're we're not plateauing at any greater rate, and we're certainly en route to meet our milestones.
Thank you.
From CBC Radio Canada, Charles.
Hi. Are Manitobans who had a dose of AstraZeneca and then Moderna or Pfizer will have to be vaccinated a third time with either Moderna or Pfizer in order to be able to travel, for example, to the United States where they did not recognize AstraZeneca as an eligible vaccine?
So right now, we're not offering third doses unless there's been an error in dose 1 or dose 2 for travel, for access to different businesses. And in regards to travel, the United States currently doesn't have any vaccine requirements for entry. They do have recommendations that they do recommend if you're not fully vaccinated that you quarantine for 2 weeks upon entry, but they don't have enforcement of that recommendation. So as far as travel to the United States, it still is based on their requirements for the reason for travel, but not specific to vaccine status. The United States so far on the CDC page defining what's fully vaccinated, they do include AstraZeneca as an example of what would be considered fully vaccinated. It's not front and center because they don't provide it in the United States, but it is in the small text on the page as well as an example of something that would be considered fully vaccinated. And they're fairly silent on mixed schedules. Now, we've seen mixed schedules being used in many countries. As I mentioned, Germany, Spain, France, Norway, Sweden, Denmark have all used mixed schedules for some individuals. So while we know that companies and countries are starting with very narrow eligibility on the basis of vaccine status, that as the desire for tourism grows, as the need for expanded customer base grows, that we expect that most companies and most countries will move to accept a mixed schedule. If they don't, if we see that the trend is to only recognize 2 doses of the same product, we can revisit what we're offering. But we don't want to offer somebody something right now that does carry a very small but not zero risk in getting a third dose if there isn't a clear benefit health-wise to that individual.
Have you begun some discussion with other jurisdictions such as Quebec who have started giving third dose to only some people who really need it to get to the United States, for example?
So we do meet regularly with all of the other provinces and territories and have these discussions regularly. And, we're all struggling with the same decisions and weighing out the convenience versus the health impacts of offering third doses. And so we'll continue to meet with them and talk about that. Like I said, entry to the United States right now does not require you to be fully vaccinated.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. Last week I asked you about the RMs Stanley, and the needle hasn't moved there at all. Still sitting at 20.7% as it was last week. What heretofore undeclared or unstated strategies are you folks going to employ to try to move the needle there and in other areas with low uptake?
So we're going to continue to work very closely with the communities. Southern Health has done a lot of work already. They've connected with many church leaders. They've connected with all of the large employers in the region and offered to facilitate vaccines for the employees, for the congregations. And we plan to continue with that work. We will reach out again to the same leadership to improve accessibility. The physicians and pharmacists in the region are working hard to make vaccines accessible to all of their patients. We also are going to continue to do things like town halls. We did one with myself and 3 physicians who work in that area. We're looking now at how we can best continue to communicate and answer questions in the region with perhaps more town halls, perhaps in-person events once the public health orders would allow for something like that, if we can do it in a safe way. But the work is going to continue. We have no intention of stopping to reach out to these communities and try our very best to help them feel confident in this vaccine and share with them the growing evidence around safety and effectiveness as it comes in to us from all around the world.
I hear what you're saying with that, but the needle hasn't moved in a week at all. I mean, maybe there's a handful of doses there, but not enough to push the percentage point past 20.7% of eligible people. So it stands to reason that to continue doing what you're doing may not have any other effect. So what would in-person interventions look like?
Well, we have a lot of evidence that one-on-one interventions can be extremely effective. So working with the physicians and the pharmacists to give them the comfort and the tools to be able to engage with their patients one-on-one can be an extremely effective way to boost someone's confidence in a vaccine. We also know that having that private interaction and the opportunity to receive the vaccine in a space where other people can't view it can also be beneficial when people are feeling pressured by friends or family or coworkers to not get the vaccine. So we're working on expanding some of the privacy options as opposed to things like super sites for people in the region who may be interested in the vaccine but not want to do it in such a public way. And also expanding where we offer a vaccine. So going into workplaces, going into community centers, and helping it to be very easy to get access, or at least easy to come and ask questions. That there is always something about in-person that's different than a virtual meeting. And so as much as we value the ability to do virtual town halls, there's a huge benefit to being able to have that in-person interaction. So we'll look to see if we can do medium or larger group in-person things in a safe way in accordance with the public health orders. But even with very small groups, having someone who can answer those questions and offer the vaccine on the spot can be extremely effective. And so the work will expand in all of these areas.
From the Canadian Press, Kelly.
Good afternoon. Going off of Bart's question a bit, maybe for those areas of the problem or of the province that are seeing little to no vaccine uptick, what is the risk? If you're speaking to them, what are you telling them about the risk not only to their communities if, say, they become a cluster point, but to Manitobans overall?
We talk about the term herd immunity and hitting a certain percentage coverage, and then we're all protected. But, in reality, when you have big disparities between where the highest amount of coverage is, and then you have pockets where there's not a lot of protection, you're still going to struggle to reach herd immunity. So if there are communities that have very low rates of vaccine uptake, they're still going to be at risk for outbreaks. There's still going to be transmission in those communities. We are anticipating that we will continue to see COVID cases going into the fall and for the foreseeable future. What our goal is to get as many people vaccinated as possible so that we reduce, first off, the number of infections, but then even those who become infected, if they've been vaccinated, we've seen great evidence that they experience much lower rates of hospitalization, ICU admission, and death. So if the virus is continuing to spread in Manitoba, those who are vaccinated are at much lower risk of both becoming infected and experiencing a severe outcome. And that's not true for those who are not vaccinated. So experiencing both the higher risk of outbreaks and the higher risk of severe outcomes is not something we want to see for any community. We don't want to see any community continuing to suffer from this virus. And we don't want to read about any more deaths happening and have to tell those families about what happened. So, we really are pleading with these communities to go and get your vaccine, get yourself protected, but just as importantly, get everybody around you protected. If you're vaccinated, you're just that much less likely to spread it to your grandparents, to your aunt or uncle who has some sort of immune compromising disease, and contributing to your community in that way can be extremely beneficial.
And we're not seeing the same level of uptick these days with vaccine dosage. So with continued deliveries of vaccine, which seems still pretty steady, but a drop in maybe people getting doses, what's the plan to avoid wastage? And have you seen an increase in vaccine wastage?
There's wastage sort of during the immunization process, which is sort of a clinical skill piece that I'll pivot to Dr. Reimer on. But in terms of ensuring that we don't waste supply, the federal government is now awash in supply. So we've moved to a pull model versus a push model. Back when supply was low but demand was high, the federal government knew that we were ready to take whatever they could send us. So we would get our allocation and they would just push it to us. We want to avoid doing that now because we don't want to start sitting on amounts that we can't use before they expire. So we are moving into a pull model whereby we look at the demand and the usage in the province, and then based on that we order or we pull from the federal government the amount that we think that we'll need. This should by no means delay anyone getting their vaccine because we will get enough in the province in time. I think, as everyone knows, we have a lot with us. These mRNAs are not expiring anytime soon, so we're not at risk of that anytime soon. But we will use what we have on hand before ordering large amounts more. But we will ultimately be able to get in enough to immunize every eligible Manitoban. So we're highly cognizant of not over-ordering and running into that piece. We're also fortunate in Manitoba, not all provinces have this, but our central warehouse does have what's called a DEL. It's a fancy acronym for saying that it's Health Canada thumbs up, that if we have it frozen, we can send it back to them for donation purposes. So that's a nice benefit to us as well. But in terms of wastage at the site or that piece, my understanding is it's still very, very low, but Dr. Reimer, you can speak to that part, yeah.
Yeah, so there's been very little change in the wastage. We're still seeing very low rates. What I would say is that there is a small but not insignificant relaxation on the direction around wastage. When we were starting and our available doses were so incredibly low, every single dose was so precious, and so our message to pharmacists and physicians, for example, was don't open a vial until you have enough people lined up to get every single dose in that vial. And our message now is more about accessibility. And so that means, if you have 2 people who come in and they're willing to get their first dose, that you can open that vial. But that does put them at higher risk of that vial being wasted if they don't get all of the other doses administered, it depends on the vaccine, but either that day or the next day, depending on which product they're using. And so we do want to continue to be really cautious about wastage and not open vials in an irresponsible way, but also not turn people away who may not come back. So it's a very difficult balance. While we have a lot of vaccine here, that's not the case in a lot of the world. So we don't want to be irresponsible and throwing doses away. And we're trying to balance that very carefully with not turning people away, because the folks coming in now are often those who are at highest risk of severe outcomes. And so to be able to give them that dose when they come in, especially if we're not sure if they're going to come back again, is also very important. So we haven't seen big changes in the wastage numbers, but our message has softened a little bit about how strict to be about opening vials for physicians and pharmacists. In our larger clinics, that's not an issue because we always have more than 1 vial worth of people booked to come in. So no impact on our wastage in any larger setting like a pop-up or a super site.
From CTV Winnipeg, Josh.
Good afternoon, Johanna and Dr. Reimer. Josh Crabb from CTV Winnipeg. I just wanted to touch on the changing of the hours in super sites. You mentioned the focus will be shifting from volume to accessibility. So does that mean you're going to be targeting communities where uptake has been low? And what does that look like? Like more pop-up clinics? Can you just sort of elaborate on what we're going to be seeing over the coming weeks starting next month?
Yeah, absolutely. So there's four accessibility channels, broadly speaking. There's our pop-ups, which we've had since the beginning of the campaign. That's sort of remote and rural areas. They will continue at the same rate. Beyond August, as we start phasing out super sites, there might be more of them if more Manitobans become eligible, and we need more of them around. The RHAs have become very nimble and flexible to pop these up quickly. So that's sort of one bucket. Then we've got what we've called our independent immunization partners, whereby corrections and hospitals and sort of health system adjacent, like the St. Amonts of the world, are able to order in from us. That continues on. Many of those are first doses as they access those kind of services or move through that kind of service. Then we have our distributed channel partners, who will remain a very key part of immunization in the future. We've built these incredible partnerships with physicians and pharmacists. We've got processes in place. They are now across the province. They will continue, and we will continue allocating doses to them as much as they can administer. But then I think the big one, from an accessibility perspective, is us doubling down on this our community-hosted clinic model, which is whereby a specific community organization or an area that partners with a pharmacist or clinic comes to us to allocate a specific amount of doses for a community that has faced barriers, and then it is the outreach and the communication is targeted to that group. The numbers that we're doing is around 8,000 a week. It might not seem that high compared to doing that much in a morning at RBC, but this is the tough work of sort of climbing up that dose one coverage. So that community-hosted clinic model will remain a very important part of our rollout as we phase out the super sites beyond August, and they'll be important for us during August as well. The application process is open for that very reason. We're taking more applications. We want to fund and support these community-hosted clinics more so. So those are our four buckets, and I think they will, by all accounts, be a part of our approach August and beyond. As Dr. Reimer mentioned, there's all sorts of possibilities in terms of what might be approved, and so who might become eligible down the line, whether it's 5 to 11, or whether it's Moderna for youth, whatever the case may be. We want to make sure those accessibility approaches they stay alive. Quick note on the operating hours and days of the super sites. For the month of August, we are by no means turning off those taps. Or rather, we might turn them off slightly, but we're not removing the taps. So if we need to turn them on for whatever reason, or we have to extend hours again, or we have to open up more days again on these super sites, that capability will remain with us for August.
And a question for Dr. Reimer on third doses. There's some early data from Pfizer saying that a third shot can strongly boost protection against the Delta variant. Just sort of wondering how this could factor into the third doses. You'd commented that there's no clinical benefit, but I suppose you're watching to see if that could change.
Absolutely, we're watching, and we're just now getting to the point where there are people who, timing-wise, might be at a point for a third dose if we saw waning immunity. We've seen data from the UK and from Canada that shows that people are still very well protected, both against the Delta variant as well over time. So Pfizer study demonstrated that at 6 months, they still were showing 91% protection against the virus, which is incredibly high and a very effective vaccine compared to what we have in many other circumstances. So, we're still early days in determining first if there's a possibility that our immune response might decrease enough that we need a third dose of the same product, as well as whether or not any variants, Delta or future ones, might escape the protection offered by the current vaccines. So no clear signs that right now anyone would benefit substantially from a third dose, but we are watching that very carefully. We're meeting regularly with all of the other provinces and territories. We are discussing what they're seeing in their jurisdictions and making sure that we're all aware of all of the data from here as well as other countries as it comes in.
From CHVN, Taylor.
Good afternoon. Manitoba citizens can get that proof of vaccination with the code if they're fully immunized in the province. But those who immigrated to the province and aren't Manitoba citizens wanting that same proof can't get it, with or without a health card. Can you explain why?
Yeah, so at this time, the nature of the immunization card technology is just, for authentication purposes and security purposes, is really tied to the unique identifier that comes with a Manitoba health card. When developing something like an immunization card, obviously it being authentic is a big consideration, and we had a baseline model of authentication with Manitoba health cards. And so that the link was made between an immunization card and a Manitoba health card. Of course, you need to be a resident of Manitoba to have a Manitoba health card. But we understand the desire and the need to have this kind of record, even if you do not have a Manitoba health card. So there's a couple things going on for how we want to address that. Namely, we prefer not to print records in our sort of records correction process, because we prefer to focus on queries. But we will print records for individuals who don't have a Manitoba health card and need that for some reason or other, or if they can't print their record or access their record themselves. And then also on the technological side, I know there is work going on to try and find a unique identifier, if you will, that can function as a health card in a way that it can link a specific person to an immunization card, so that becomes an option down the line. So we appreciate that sort of that gap, if you will, and we're working through it.
People who do have Manitoba health cards are not able to get this. Can you just explain more about why this specific scenario is still happening, and why people who are immigrating to Manitoba didn't know that this would be an issue that would come up for them?
So everyone who has a Manitoba health card and was vaccinated with both doses and have waited the period after their second dose should be able to get an immunization card. The only barrier to that will be if there's a records correction issue, or if the information on the health card doesn't match the information that an individual enters when they apply for the immunization card. And that's the records correction process that we're working through. There's been about 35,000 of these in total. They do come in every single day, because we're still administering thousands a day, so a percentage of those will come in with these kind of queries. Of that 35,000 or so, I think we're at just under 2,000 outstanding in terms of just record corrections to make sure that the dose is entered correctly, or if they have a Manitoba health card, do they have the right information on the health card compared to what they used when they applied for the immunization card. So that 2,000 figure is fairly healthy. We want to drive it down to zero. We'll keep doing that. There's a lot of queries coming in, about 11,000 or so, that's just for printed records, many of whom have a Manitoba health card and have the Vax card. So we're trying to phase out that a bit, but we will print out records for individuals who don't have a Manitoba health card. So there shouldn't be an issue. If you have a Manitoba health card, you can get it. It's just for a very small percentage of individuals, they might have to get their records corrected, and we're working through that process. I should note there is now about 800,000 fully vaccinated Manitobans. So less than 2,000 outstanding queries specific on records. That's a tiny margin. Certainly that doesn't deal with the frustration that individuals feel who are waiting for this, and this is why we're still actively working on it. But the vast majority, 99% plus of individuals, are getting the Vax card if they have a Manitoba health card.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Reimer, going back to the question of third doses for international travel purposes, do you think the approach in Quebec to offer a third shot has any merit? And would you have to wait for federal guidance before perhaps following suit here in Manitoba?
You know, every country has its own rules for whether or not they require vaccination and how they define someone as being fully vaccinated. And so it's very difficult to create a program that meets the needs of everybody for every possible scenario. So far, we're not seeing it as a barrier in most countries for entry, but it is something that we're watching. And you know, certainly it's frustrating to have challenges in being able to travel, but for the most part, most countries are not refusing entry based on what we've offered here in Manitoba. We will be watching it because, as I said, right now, with there not being a clear medical benefit to a third dose, we want to be very cautious about providing a third dose when there is a very small risk associated with every time you receive any medication, treatment, natural remedy, or vaccine that you don't need. So it's we're trying to be very cautious and work with the other provinces to have as much as possible a consistent approach. And we'll continue to do that and work with the federal government as well to have a consistent approach there. If we do along the lines find that countries are not recognizing a mixed schedule, and if that expands or continues to exist, we'll need to revisit and determine whether or not the risk to the individual may be worth it for the benefit of being able to travel.
Thank you very much. And so we're getting close to approaching or reaching our next reopening target. And at that time, most restrictions will be lifted. How severe does public health anticipate fall outbreaks will be in communities with areas of very low vaccine uptake? And is there any estimate as to how soon we will start seeing significant divide in COVID rates between vaccinated and unvaccinated people?
I mean, at this point, it's a lot of educated guessing about when we expect to see rates go up again. You know, we're looking at things like influenza and the seasonality that we see with that, as well as other respiratory viruses like RSV, and making some estimates based on that we would see a similar season related to COVID. Now, certainly we've had waves that weren't in the same season as our usual influenza, so we have to be cautious in depending too much on what we've seen with other respiratory viruses. But overall, certainly with the rates of vaccine we've seen in the province, we do expect that while cases will occur, that the outcomes are going to be much less severe. And so we're looking forward to being able to have a different approach to how we manage things in the future, with the knowledge that outbreaks will likely be smaller and will likely result in fewer hospitalizations and fewer deaths. And while we will see some potential discrepancy in communities that have lower rates, for the most part, even areas of the province with lower rates still have a good proportion of their population vaccinated. So we still would see lower severe outcomes than we have in previous waves. So we'll have to wait and see and keep a close eye on what's happening with hospitalizations, ICU admissions, and deaths, and adjust accordingly. And public health will be doing that work going forward.
From Global News, Anya.
Good afternoon. With American tourists able to start traveling back to Canada soon, what's the plan to recognize vaccine cards from outside the country?
So I think that's a great question for the federal government. You know, as Dr. Reimer said, various jurisdictions are going to make their decisions. Our national level will have to make that decision as well for who crosses international borders. Yeah, I don't know if you have anything else to add, Dr. Reimer.
No, we're certainly working with other jurisdictions to, reciprocally recognize each other's documentation, but that work is ongoing as many jurisdictions are just developing their final documentation and their rules, and will be continuing to adjust their rules. So we're absolutely waiting on the federal government to see what they may do as far as expanding access to the border going forward.
Okay, great. And with the federal government now stocked with enough shots for every Canadian, what's the plan for stocking the vaccine in Manitoba for the future?
Yeah, so we are not currently thinking around stocking any vaccine because the ordering model is working very, very well. If we need to order an amount from the federal government, it gets here in time, and we can forecast early enough if demand spikes or seems to be spiking so that no one has to wait for a vaccine because of a supply issue coming into the province. We have hundreds of thousands of doses in the province now. We don't see that as a stockpile. We see that as something we want to get out the door and into arms. And the federal government has moved to a sort of a model where they will protect our allocation for as long as we would like it to at the federal warehouse. And then after a while, if we want to relinquish it, it can go into a reserve that will be managed by the federal government. We can, of course, order it in if we'd like to at any time. So that kind of stockpile management reserve piece is with the federal government at the moment. What's important to us at the moment is still getting doses in arms, making sure that our allocation is protected with the federal government so that if we want to order it in, we can, and that allocation is being protected. And then as Dr. Reimer mentioned, we want to be very careful about not abusing the amount of vaccine that we have now in the country. There are many places that don't have it. So we'll order certainly as much as we need to get doses in arms as quickly as possible when the demand is there, but not more than we need.
Our final reporter this afternoon from the Brandon Sun, Kimberly.
Good afternoon. This question is for Mr. Botha. Mr. Botha, last week we learned there were more than 12,000 requests for vaccine record corrections open with the province, and those are only the ones the task force is aware of due to the complaint. As the deadline for the vaccine lottery approaches, how can you be sure all Manitobans who were vaccinated are entered into the draw, or do you recommend that people check the shared health portal to make sure their records are correct?
Yeah, so as I mentioned, the amount that's relevant to records correction for the draw is as of today around 2,000. We're working through those pretty quickly, so we're feeling confident about that piece. The larger figure that we're seeing, sort of the 11,000 that I had mentioned left over, is requests for printed records. Some of that is individuals who would just like a printed record, even though they're already in the draw and their records are fine. The other ones are individuals who do not have a Manitoba health card. So that's the bulk that we have to work through on that front. The 2,000 that we're working through now, I think we're feeling pretty confident that we'll get down.
Okay, thank you. My second question, again, is for you, Mr. Botha. The Keystone Super Site covers a large area. Its hours have been reduced again, apparently, for more targeted outreach to individuals. Will the targeted outreach be in the Brandon area, or where exactly will that take place? Who are you targeting? How do we notify people of the location and hours for those areas?
Yeah, so we certainly don't want to reduce accessibility inadvertently by reducing the hours or the days of a super site. The moment we feel like we're getting into a scenario where there is a demand for greater hours or greater days at one of our super sites, we will open them back up to those. We've been in a situation for a while now where, for some parts of the day or some days, these very large, powerful sites are pretty close to empty. So we have there are more effective and efficient ways to get the vaccine to individuals while keeping the super sites open for the demand that is still there for them, namely individuals who have a second dose appointment at these sites. In the context of Prairie Mountain, the pop-up campaign will continue there. There can be pop-ups certainly in the Brandon area to augment any hours issues with the Brandon Super if that's needed. But Prairie Mountain has seen lots of pop-ups, so they'll continue to see lots of pop-ups. Prairie Mountain was sort of the innovative regional health authority that started with the doses in provincial parks. So that sort of thing will continue in the area. There's community-hosted clinics that are in Brandon as well. There are pharmacists and physicians in Brandon who has the vaccine. We ship out to health facilities there. So Brandon will have the vaccine that it needs, and if for some reason we think that the super site has a greater demand than what we have it open for, then we'll open it up for longer.
Thanks, everyone. This concludes our media briefing.